This webinar that we're doing is going to be talking all about cupping. So first thing to kind of go over here would be about me a little bit so that you guys know. My name is Dr. Bryan. I'm a chiropractor that's in the Toledo area, specifically in Sylvania. And basically, I have a bunch of different certifications that that I've gotten over the years for a variety of different topics. I got voted best in Toledo 6 different times by different papers and different stuff like that. And I have been an instructor in anatomy and physiology at the local community college that's around here. Okay, so the main thing that we are talking about today is cupping therapy. There's a whole bunch of different stuff that kind of goes with it. Cupping has been something that I have been interested in for a very long time, but in reality, this is something that has been newer for one of the therapies that I do in my office. I always have been somebody who I don't necessarily like to experiment with stuff that I don't know what I'm doing. So I feel like I needed to take a course on it, and I was able to within the last year. And it's something that I've started to actually do the cupping on a regular basis, and I actually really do like it. So with that being said, let's go ahead and talk a little bit about cupping. As you can see by the video that's there, I should say the picture that's on your screen, cupping is basically when you are using some type of device in order to lift the skin using suction. Okay, so cupping it's a therapy that's been it's been used for thousands of years. It involves typically like the placement of glass, bamboo, plastic cups, any number of different things on the skin. And it basically creates a vacuum. And then once it creates the vacuum, and you suck the air out of the inside, it basically lifts up and sucks the tissue up into the cup. All right. The purpose of the therapy is basically to help create better circulation. It can help to relieve pain. It can release toxins from the body and through the skin. Basically, you use pressure in order to pull the tissue, you pull the skin, you pull the muscles upwards, and then you can expand the capillaries to increase blood flow and oxygen to areas that are in need of therapy. It also has the tendency to produce a relaxation response in many people, which can be a good thing to kind of, help people calm down with anxiety and other kinds of stuff like that. So that's the first part of it. So getting into it a little bit more, like I said, cupping is something that's been around for thousands of years. This is another version of cupping. You can see on the top the suction cups that are basically like you do the squeeze ball, and these are a little bit different because they also have a magnet in them. Different things do, and different people do them for different reasons, and we'll talk a little bit more about it. But like I said, cupping is basically a therapy that's been around for over 3,000 years. The first recorded commentary that they have, like basically where it was written down, was basically back in Egypt, back in like 1500 something BC. So it's been used for a very, very, very long time. Basically, now a lot of people know it as a component of traditional Chinese medicine, or TCM. But cupping has been around a bunch of different cultures. Again, ancient Egyptian, ancient Greek, and then within cultures in the Middle East, and then obviously like in like the other Eastern areas, so like Asia and stuff like that. So there's a variety of different places. So obviously China, Japan, that kind of stuff. Thailand, a whole bunch of different areas where it's been done. So again, this is something that's been common, all over the world for thousands of years. In the Western world, back in around the 1880s, cupping started to kind of like fall out of practice. And it had more to do with the fact that people didn't know exactly how it worked and what kind of stuff that, like, they knew that it worked and that it had a good amount of results, but people started kind of, approaching more of the whole scientific aspect of like, we want to know exactly how this worked and how it does things. So it's one of the reasons why it started to go out of it started to fade in its popularity. But more recently, cupping has become it's been more popular in recent years by practitioners of traditional Chinese medicine, acupuncturists, massage therapists do it, some physical therapists do it, and chiropractors do it. And several years ago now, it started to become more popular when people noticed like the swimmers at the Olympics getting the characteristic type of bruising that they had on their back. And obviously people needed to know what was causing it. So years ago, people would see at the Olympics the kinesiotaping stuff, and then that was where it started to get popular. And then you start seeing on the swimmers, or like some of the like beach volleyball players or something like that, these marks, and people wanted to kind of know what it was that they were there. So there's all kinds of different things that can be related to cupping. Now there's different types of cups that you can use to do this, and this is going to be, I'm not going to say that this is a gnarly one, but it's definitely an interesting one. There's all kinds of different variations. So in the top left there, those are actually bamboo cups, and there's multiple different types of cups that are available, like I said. So bamboo cups are up in the top left corner of that. You have porcelain cups, or like pottery would be something that would be available. And then the other thing that was available was animal horns. Again, that's something that is used, again, in multiple different locations that are around the world. Again, you have an animal horn. If you can hollow it out a little bit, you can end up getting that cupping action, and create the suction, because again, these animals lose the horns on a regular basis. So they're laying around, you collect them, and then you can use them for cupping. So that's the thing that you show on the back. And obviously it looks a little bit gnarly when it looks like somebody has a whole bunch of horns that are sticking out of their skin, but that is kind of the way that it works, right? So it's interesting how different things happen. So again, traditionally things like bamboo and animal horns and all that other kind of stuff was used for the cups. In modern times, things are a little bit different. It's not really considered sanitary for many of these things, because you can't obviously like sterilize them in between patients, or clean them very well in between patients. So the other thing that can be difficult about all of these things is that you can't monitor the skin when these kind of things are used. So one of the things that happens is that if you use a lot of suction, the skin will really pull up into the cup, but you don't necessarily know how much is in there if you can't actually see the skin. With some of the other versions, you can actually see through them, and therefore you can see how much suction is actually happening, and it can give you an idea of how intense it is for the person, and if it would be causing damage to the skin. Okay, there's another picture here. This one is kind of cool because this is like, again, it could be mother and daughter, I'm not really sure, but it's dated in 1856. So it's a cool little thing, and it might be hard for you to see, but if we go to the center of this picture here, again, this is going to be a woman who is using the horns, and using the cuppings for the horns here, and just basically applying it to the knee. Okay, so it's kind of cool on how some of that stuff works. Now, the more modern versions of what you have is that there are plastic and glass and silicone are basically the options that you have. Plastic ones are typically done where they have the valve, which is the bottom picture. Okay, so the valve with the bottom picture is something that is where they get sold in sets. These are something that people will buy on Amazon, even though they don't know what it is that they're doing. And I would caution somebody from doing this on their own when you don't actually know, because there are some different things that it can cause damage with. But these plastic vacuum cupping sets, again, they're fairly common in practitioners' offices, and they're probably the most commonly type of things that are used at home when people do have them. There's a little hand pump that will attach to, in this picture, where the yellow or orange where the top is, and basically you can pull it a couple of times and you can create the suction by getting that out of there. Okay. These are the cups that they will typically put magnets in, and they would put magnets in for a variety of different reasons. And we'll talk a little bit more about that here in a little bit. But the one on the top right there, those are silicone cups. And those are going to be ones that, if you were to do this on your own, these would be the ones to get something that are like this, just because of the fact that these are going to be not quite as strong as some of the other types, but it also means that you're not going to get injured using them. The silicone cups are actually pretty nice because they can, if somebody has like irregular features, like if you're doing it around a knee or something like that, these can actually work a little bit better. The most common ones that are used are actually the glass cups, which are the top left there. Okay, those are the most common that are used in other practitioners' offices. With this one, you actually create, and the same thing with the horns and the bamboo cups and all that other kind of stuff. You actually create the vacuum using fire, so it's called fire cupping. And in that case, and again, glass cups, pottery, animal horns, bamboo cups, all of those are going to be using fire. When you use fire, basically the goal is that you would put something that is on fire inside of the cup and then remove it. And then when you do that, when you heat up the inside of the cup, it basically pushes all the air out. Again, it gets like less dense. And then once you place it on the skin, because the air has been pushed out of it, it ends up creating a vacuum as everything cools down. So, and this is not something that should be done by somebody who's not trained. And in fact, in this picture that I had found, I would not be doing this over top of somebody's skin. You don't want to put the fire over top of somebody. That's kind of problematic. So basically, you put something in, and then in some cases, somebody might use like a match or something like that, wait for the fire to go out and then place it down on the skin. But again, it's that lack of oxygen that creates that suction as the cup cools. And again, the hotter that it is and the longer that you hold it in and all that other kind of stuff creates more of a suction, and it makes it stronger. And again, this is going to cause the skin to rise up underneath it. It will redden as the blood starts to flow into that area. And again, you set the cups separately and then you kind of leave them in place for a little while. And it depends on what it is that you're doing, on how you actually work that. So the next thing is talking about different cupping methods. And these are kind of like, general kind of things to kind of talk about. And I'll get a little bit more into like, what the different versions are. But basically the cupping methods that are available are three general kind of types. One is called dry cupping. Another one is called massage cupping. And the last one is called wet cupping, which is interesting. We'll just put it that way. Again, each therapy is going to have different benefits and targets, but dry cupping is the most widely used. So let's talk about them a little bit here. So the dry cupping technique is basically when you're using, and again, on this one, you can see the edge of the vacuum pump that's attached to the one that's kind of like floating in the air there. Dry cupping is going to be one of the most widely used kind of techniques. And it can be something that's like this, where you're using the suction, or you can use a flammable substance and put it inside of another cup that basically, just like we talked about before and like the video showed. But the thing about this one is that dry cupping is basically when you leave it in place. You put the cup in place, and then once you put it in place, you leave it there and you don't take it off until it's time to be done. Again, there's multiple different versions of it and there's different reasons to do different stuff, but dry cupping or static cupping is going to be the most commonly used type in most kind of cupping situations. Okay. The next one is called massage cupping, and it's also known as moving cupping. And basically the idea with this one is to do massage cupping or moving cupping by using some kind of a lubricant, like a massage oil or a massage lotion, or something like like Tiger Balm or something along those lines, to basically allow you to actually slide the cup across the person's body as they do it. And again, as you would do that, the cup starts to lift up the skin as it starts to move along. And again, you can move it and put it in a couple of different places, and you can create an effect with that, right? So again, you put the cup on the skin, you have the lotion that's already there, and then you can kind of move that around. Now, again, when it comes to something with massage cupping, this is the main reason why I wanted to get involved with cupping or start doing some cupping, because I knew that this would end up being something that would be useful to my patients. And this is something that I do on a regular basis now. Right. The idea is that it lifts up the skin as you move it along. In this case, in the picture that's here, this isn't my favorite picture, but it kind of shows you, you can see that there's oil on the skin there. The silicone cups or whatever that's there, it's kind of like you're using it's kind of like the silicone cup that I showed you before, but this one isn't going to be able to use a lot of pressure. It's not going to stick very well. And honestly, the silicone itself doesn't actually like roll on the skin very well. So it's kind of difficult. And the same kind of thing with the plastic cups. So usually when it comes to the massage cupping techniques or the moving cupping, that is typically something that would be done, at least for sure in my office, it would be done with glass cups. I have a silicone set of cups and I have glass cups, and I use them on people kind of back and forth depending on what people need. So basically, again, you apply the oil to it, you move it along, and it basically lifts the skin as it moves along, and it creates that negative pressure in order to pull that skin into it. So it's an interesting kind of a thing. Now, the next one, I'm going to just tell you, hopefully you're not squeamish. If you are, you might want to look away here for a second. But the next one is called wet cupping. And wet cupping is something that involves blood. So it's a little bit of a different kind of a thing. I'm going to change the thing here, so it's going to be a little bit of a different picture. So like I said, this is one that is a little bit different. This is going to be in the more traditional Chinese medicine type of stuff, and it's not something that I would do in my office. But wet cupping is basically when you use cupping, but before you place the cup, a person might do a little bit of cupping beforehand and then get some blood into the area a little bit. And then basically what the person would do, the practitioner would do, is start lancing the skin. Like you can use a couple of different things, whether or not it's like, a little lancet or other kinds of stuff to basically puncture the skin in a couple of different places. And then once you do that, then you would use like the vacuum pump that's there, which again, I wouldn't even recommend if that was the case. Or you can use like the fire cupping in order to do that. And again, when the cupping comes, like the suction actually will pull some of the blood out, and the blood, as you can see in this picture, actually like pools around the bottom of it. And some people, when they do this, they actually, like I've seen pictures where there's actually like a decent amount of blood that's there. And it's done for a couple of different reasons, but again, the traditional Chinese medicine version of it is not the one that I typically do, so it's not something that I usually concern myself with, right? But it's supposed to draw toxins out of the body, and it helps to remove stagnant energy so that you can start to heal. But that's the general idea between wet cupping. Again, this is going to be something that is probably going to be, at least in the Toledo area, is probably going to be less likely to happen, just because I don't think the massage therapist would be using the wet cupping techniques. It would probably need to be somebody who is more of a traditional Chinese medicine type of practitioner. So speaking of that, let's go to the next one, because that talks about traditional Chinese medicine. So the idea is that when it comes down to it, there's two different ways that you can kind of look at cupping. One would be the way that I do it, which is kind of more of like a biomechanical standpoint. And the other version would be the traditional Chinese medicine standpoint. Now, in traditional Chinese medicine, again, this is one of those things that I don't do traditional Chinese medicine. I don't do acupuncture. I've been always kind of interested in it, but it's not something that I really have the time to pursue because of all the other things that I've been involved in over the years. So it's a little bit more difficult for me to get into it, because again, learning all of that stuff with acupuncture and everything, again, I think it would be fascinating. I don't know how much, like, because I don't know everything about it, I can't sit there and say that it's the best thing in the world, but it's something that I'd be interested in learning at some point. But that being said, the whole idea of traditional Chinese medicine, like one of the main concepts, is this thing called qi. You can call it life force or other kinds of stuff like that. But the idea in traditional Chinese medicine is that qi flows in different meridians that you end up having in the body. When people talk about chakras and stuff like that, it's actually kind of interesting, because the chakras in Ayurvedic medicine, or in like medicine, like in ancient India and stuff like that, is something that correlates to one of the different meridians that you talk about with traditional Chinese medicine. So it's interesting that there's some kind of overlap that's there. But the idea is that in traditional Chinese medicine, you want to have qi and blood flow through the body unobstructed. You want it to be free. And when it flows unobstructed, you want there to be, that is going to be the situation where a person has no disease and they have no pain, right? In that TCM type of stuff, if qi or blood flow ends up getting slowed down or obstructed, it can create disease. And then one of the things can be pain. And obviously this is a completely foreign concept to people that live in Western countries that haven't been exposed to it. It's a different way of thinking about it. It's not necessarily something that I'm gonna, like put all my eggs in that basket. But what I will say is that when it comes to traditional Chinese medicine, is that there's things that have been done in traditional Chinese medicine for thousands and thousands of years. And it's one of those kind of things where, like, again, I do think that with a lot of different things, there can be a little bit of woo-woo. I guess is the best way to say it. But if something has been producing results for a very long time, I do think that it's something that you should kind of look at. But cupping is basically thought of, it's basically an adjunct to, or as a part of traditional Chinese medicine. Again, there's acupuncture, there's moxibustion, there's other types of herbal therapies and other kinds of things like that. And there's a whole bunch of different stuff that's there. But a traditional, like a practitioner of TCM, they might say the following things are the actions of cupping, that they will expel exterior pathogens. So they talk about things like wind and heat and other kinds of stuff like that that are flowing in some of these channels. There is cupping can help to induce the smooth flow of qi and blood. You can help to open up the meridians. You can help to sedate the nervous system. Again, that was one of the things that we talked about before earlier. There are issues with stretching the muscles and the connective tissue, which is, the way that I would look at doing stuff, loosening adhesions, and then even strengthening the immune system. One of the people that taught me about this, she is a licensed acupuncturist, chiropractor. She's absolutely awesome. And it was one of the things where, as we were going through, she definitely is very into the idea of doing this when somebody ends up having a cold and other kinds of stuff like that in order to help to strengthen the immune system. So that's basically that. So let's look a little bit more about how cupping works from a different point of view, maybe. Right? So when it comes down to cupping, what is it doing? Cupping is going to end up developing what's called a negative pressure, right? So again, the vacuum portion that's going to be there. When you develop the negative pressure, again, the strength of the pressure is going to help to lift the tissue up into the cup. And when it does that, it actually can help to separate out different levels of the tissue. One of the things that's done when people do myofascial release is that sometimes people will do what's called skin rolling, which is basically lifting up the tissue and kind of moving along. And this is one of the things that you can actually kind of get with cupping because you're separating out tissues. Another thing that cupping can do is it can cause vasodilation. So because of the suction that's created that's there, it helps to widen the blood vessels. And in part of one of the things that you do in it, not just the bringing blood to it, helps to forcibly widen the blood vessels, but you also end up getting a localized response of vasodilating chemicals. Things like histamine and other kinds of stuff can end up being released because of this. Another thing you can look at is that the fluids can that are going to be present in the body, that you can have an enhanced fluid exchanged. And the idea behind what that's talking about is that you're talking about, you have fluid that's in the blood, and you also have fluid that is in between the cells, and you have structures that are in between the cells. And you can end up having debris and other kinds of stuff that kind of like can exist in there. The idea is that you can help to exchange fluid and any kind of extra stuff that is left over or debris that's left over in the tissues. When you separate things out and when you increase the blood flow and that kind of stuff, you might be able to help to increase the uptake of the debris or the reabsorption of that debris and get rid of that. Okay, so The other stuff to think of is that, again, the increased blood circulation, again, improving blood flow, which can help cells to repair faster. You can improve lymphatic flow, which is getting things to drain out a little bit better. And just bringing more blood to the areas can increase the number of white blood cells that are present in that area. And it can also help the person to get a little bit better. The next one is relieving pain. Right. So just in general, cupping, one of the biggest things about it, again, there's a bunch of other stuff that you can, argue whether or not it is helpful or whether or not it works or any of that other kind of stuff. But the one thing that is well known is that cupping has the tendency to relieve pain. Okay. And again, you can start talking about removing toxins and increasing circulations and all that other kind of stuff. So when we talk about what cupping treats, there's a whole handful of different things. We can talk about a bunch of different stuff, and we'll kind of go into these here in a little bit. But again, by getting in there and releasing the toxins or stimulating blood flow, cupping can be used as a preventative and a healing therapy for a number of different conditions and ailments. Some of these are going to be like looking at them maybe from more a traditional Chinese medicine aspect, which again, somebody that does that would be able to help you more with that than I will. But they can be helpful for relaxation, overall well-being, those kind of things. So I'm just going to kind of go over these real quick. You can help to restore digestive health. You can help with pain relief from a sore injury or from an injury or a sore muscle, migraines and headache reliefs. You can end up with helping with the common cold or lowering blood pressure. You can help with depression and anxiety with some of the calming effects that it has. And then there's cosmetic reasons where you can help to mobilize cellulite or rejuvenate like the face, or like, facial cupping. And then even breast enhancement is one of the things that can be done with it. So for cupping for muscle and muscle, like pain, injury, those kind of things, again, the natural response is to become inflamed. And when you become inflamed, again, some people will reach for the ice pack to reduce swelling, but a little bit of swelling is something that's actually needed as a defense mechanism to help to stimulate the healing. I always say that, like a fun way to start a fight, I'm not saying that you should do this, but it works, is that if you were to go on to the physical therapy subreddit and type in something about how, like, ice is the best thing in order to, help an acute injury, and then you kind of sit back, people are going to fight about it because, like, it's controversial. People have done ice for a very, very long time and people know some of the benefits, but there's research that shows that ice isn't necessarily the best thing to use. So again, as opposed to reaching for an ice pack to reduce swelling, one of the things that you can do is stimulate healing by drawing blood to the site of the injury or pain. So cupping the muscle injury basically works on that general type of theory. You bring blood to the area, you bring it to the area of the injury in order to help promote healing. Again, the idea is that you can help to create some new blood cells. You get the blood that's there, you bring the nutrients that's there to the area that is injured, and you can end up helping the body to heal up a little bit faster. Okay. For headaches and migraine, again, migraine, the one of the theories is that a change in the blood supply to the brain is one of the things that causes migraines. So, if you can affect the muscles at the base of the skull, that can be one of the things that can change how the brain actually processes pain, and how it, like, the pain from the muscles, how they can refer into the head and cause migraines and other headaches. Basically, the idea is that you can do cupping on the neck and the base of the neck, on the forehead, on the cheekbones, and different stuff like that in order to help to relax the muscles. Obviously, you have to be careful when using it on the face so you don't give somebody major bruises that's there. But you can help to relieve pain by getting in and working on some of the different areas of the head and neck. Okay, so when it comes to doing this, the way that I kind of refer to cupping as, it would be myofascial decompression. It's not just cupping. You're literally kind of doing things. And again, this picture is showing the fire cupping. This is basically how I would do it in my office, except for I wouldn't have somebody like half naked like this, with a just a towel over them. A person's going to have to undress to a certain point because it has to go directly on the skin. So there's a couple of different things with it. But when it comes to myofascial decompression, the idea is that you're using that in order to separate out tissues, right? Just kind of like we had talked about before. So myofascial decompression in general, it's used on muscle groups and fascial planes. So, there's a bunch of different muscle groups that'll work together, like the calves or the quads or different stuff like that. And you can use the different fascial planes that you have that are there. As you do the cupping, and the cupping sits there, as the cups sit there, it can help to increase the elasticity of the fascia and the muscles that are associated with the area. Again, you can increase the multi-joint ranges of motion, and then you can help to restore mobility, which can end up leading to decreased pain. So the idea is that it's opening it up. And really what it comes down to is that, for myofascial decompression, it is not doing something as part of you're not doing it on acupuncture points, or you're not doing it as part of meridians or anything that's associated with that. You're doing it on the areas that are painful, or the areas that might be interrelated with an area that ends up being painful. So it is a component of manual therapy and manual release type of techniques, and the way that I look at it is it's a complement to the Graston technique that I do here in the office. So the Graston technique is where you use like metal tools to kind of dig into different areas of soft tissue, like whether or not it's the joints or whether or not it's muscle or ligaments or whatever. And by digging into it, you can help to stimulate healing and help the muscles to relax and things along those lines. But it uses pressure pushing in, just like you would during a massage, to do it. But it's very specific with how it does it and how it separates out fascia. This is going to be kind of the opposite, where it's going to kind of lift the fascia and separate it out and allow the fascia to move and remove some of the adhesions that are there. Okay. So, some of the other stuff that you can do, and again, these are going to be more, probably more of the traditional Chinese medicine version of it. High blood pressure is one of the things that you can do to, one of the things that is theorized to be able to be treated with cupping. So high blood pressure, again, it's, one of the ways that you might look at it. Again, I'm not saying that this is how everything actually is, but one of the ways that it gets viewed as the blood ends up becoming thicker. And if the blood is thicker, it's not able to flow freely through the body. And if it's not flowing freely through the body, that's going to increase, your blood pressure. So high blood pressure ends up forcing the heart to expend more energy. You don't have a proper blood flow when you're doing it. In people that do the cupping for high blood pressure, sometimes they will use wet cupping for it because the punctures in the skin pulls out some of the thicker blood from the system. That's one of the things that's theorized. And what's interesting is that when you do the cupping, you will actually notice that in some locations, cupping won't really cause any bruising at all. In other locations, it'll cause like a minor amount of bruising. And in other locations, when you do the cupping, it'll actually, it can get extremely dark. And the darker that it gets, the more that people, that do that have the tendency to say that it's old blood and old injuries that are basically being cleared out. So it's an interesting kind of way to look at it. But, and again, there's multiple different things that are there. Again, cupping can focus on, multiple different areas like the neck, the inner calf, the inner thigh, different stuff like that. And again, the idea is to increase blood circulation in order to help decrease the problems with high blood pressure. The next one is cupping for healthy digestion. I would actually put maybe a little bit more weight behind this stuff, is just like, without having experience with doing any of it, I would definitely feel that people could end up getting some effects with healthy digestion with this. So again, stress, anxiety, tension, you can have different things that are affecting the body. Again, all of those things can affect digestive issues like bloating, gas, constipation, irritable bowel syndrome. And it is part of the different responses to stress and other kinds of stuff. You can end up having tension in the body, and that can be, associated with the abdominal organs as well. So cupping can help promote relaxation. It can help to relieve stress, improve digestion. Again, if you stimulate the digestive tract to help break down and process foods differently. If you're calming down the sympathetic system, that's going to be something that can aid in healthy digestion. So there's a whole bunch of different things that can be associated with that. So another one that's interesting that, you start getting into some of um, well, and we'll talk a little bit more about the cosmetic stuff here in a second, but cellulite or cellulite is going to be something that, again, with the dimpled skin that you get in certain areas, again, that ends up being something that's associated with, the dimpling in the skin. It's something that happens at all ages. It's normal. It's not a big deal for people to actually have it, but sometimes people want to help get rid of it. And cupping is supposed to be one of the ways that can actually help with that. So again, the idea is that um, you want to stimulate the lymphatics and basically lift up the skin to help break some of the adhesions that are there. Again, it can break up fat stores, and it can increase blood flow in order to help to get the area moving that's around it. Like we had talked about, there's issues with insomnia, or I should say depression and anxiety. The cupping is something that's supposed to be good for anxiety because of the calming effects. Again, if and from a TCM perspective, removing toxins and removing stagnant energy, the negative pressure basically pulls the energy up out of the body and helps to increase blood circulation. People can end up having to rebalance their serotonin levels, and they can have reduced feelings of anxiety and stress and depression. It's non-intrusive. There's no side effects to it. And again, honestly, I think that one of the things that it does is that it basically adds this firm pressure, which is probably not all that different from somebody using like a weighted blanket and other kinds of things like that. You're stimulating the brain when you do it. And it's one of the things I think that can help with this. Again, it wouldn't be the only treatment, obviously, for somebody, but I wouldn't necessarily say that you wouldn't be able to get any help with depression or anxiety with cupping, right? You can do it for anxiety or for insomnia. Again, same kind of stuff. If you help calm the nerves and relax the mind and that kind of stuff, you can help to get somebody to sleep. It's supposed to help with producing the hormone melatonin. But again, you're improving circulation, and it can help create balances with the basal metabolic temperature in the body and help you to have like a good, comfortable temperature when you go to sleep. Okay. So there's a bunch of different things that are associated with that, right? Again, cupping points, depending on where you do it, they can be done for, different acupuncture or acupressure points that can be around the body. Again, that's one of the things that people would use with magnets in order to help to stimulate when they're doing it. And again, it's not something that I'm necessarily going to be doing, but it is something that is available or it's out there. Another one that we talked about that kind of goes along with the cellulite ends up being facial cupping. So obviously these are different cups. The suction that's done is with little bulbs that are on the end in order to be done as a beauty treatment. A lot of times this can be done with moving and other kinds of stuff like that. So the moving cupping, obviously you wouldn't want something to actually cause a bruise when you're doing it. But the idea is that the moving it through the skin ends up helping to kind of rejuvenate the skin and kind of plump things up and make it so that things are working a little bit better. Again, you're increasing the blood flow to the skin, which that's the idea to help to make things better. The other thing that's interesting is that this can also be something that people do for breast enhancement. And obviously I'm not going to have an extra, slide specifically for that, but the same kind of idea happens with cupping. Again, because you have connective tissue that's involved and different things that are, movements that are there. Again, certain types of, cupping can be done on the breasts in order to help lift them a little bit. Basically, it ends up being something that obviously somebody would need some expertise with it. Again, it's not going to be something that I'm really doing in my office, but it is one of those kind of things that, I have heard from people that when they go through and they experiment, from women who basically would do this, where they would experiment to see how well that it worked, that they would cup on one side of their body. And then after they cup on one side of their body, they know that they have to go to the other side to do the other side, because things don't look right after they've done it, because they've actually like moved things and they've supported the body and different stuff like that. But again, cupping is it can be used as a beauty treatment. So again, there's a bunch of different stuff that kind of goes with this, but again, it's something to just kind of understand that there's multiple different options that are there. So things to expect during therapy. Again, cupping sessions can be done in a couple of different ways. Again, you can use it with acupuncture or acupressure or massage. Again, in our office, we could use it with doing a chiropractic adjustment. We could do it along with Graston technique, or maybe instead of Graston technique. Sometimes people are going to be in a room where they're going to be basically by themselves with the cupping. Other times, if it's something that we might want to actually have them do movement, I might have them like lift some weights or do some movements or do some stretches while the cups are actually applied, in order to get that movement and to kind of like open things up and get things to move a little bit better, right? So obviously, regardless of how you do it, again, you should try to talk to the practitioner to kind of find out what they're going to do, and like discuss any concerns that you have, in order to make sure that you have the best experience that you can have. Again, the cups can be, maybe just one cup. You might do several. I've seen some pictures where somebody's got like 40 cups on their back. Again, that's not typically something that we're going to do in my office, but I'm also typically not doing the static cupping where everything sits. I'm usually taking cups and shifting them and moving them back and forth over the different areas that end up having pain. So somebody might be in place for just a couple of minutes. Sometimes you might be 10 minutes at a time that a person might be laying down. They might be by themselves for the 10 minutes. And it really depends on what's going on. Cupping might feel a little bit uncomfortable. It shouldn't be painful, but it could be uncomfortable due to lifting of the skin. But like I said, you shouldn't really have any pain during the process. So after treatment, one of the things that happens is that this is the round red circles that you get, that basically where it starts to pull it up to the surface. Again, this is generally basically broken capillaries. Different things. People would argue with different things about what is there for people who are doing cupping from a TCM perspective. Again, the discoloration, and I can tell you that they're on the same person in different areas. One area might be more discolored or be darker, or whatever. And if you have the same kind of if you have the same like pressure on each of them, it should be the same amount of bruising that's available or that's present in each of the different locations. But in this location might have a little bit of bruising, but a little bit further up might not, right? So it depends on the person and where everything is going. Some, like I said, some believe that the more visible the discoloration is, the greater the level of stagnation that's there in the blood, and then the greater that there is more toxicity and there needs to be more cleansing that's there. So discoloration typically fades over a few different days. Sometimes when they're really bad, it can take a couple of weeks for the bruising to kind of fade out. But what's interesting is that with the bruising, most of the time, it's not actually that painful. When people get bruised when you're doing the cupping, it's not like the bruise is kind of more superficial, and it's not really like deep in the muscle. It's more like surface level. So once it's been like a day or two, you could run your fingers over top of it. There's definitely not going to be any swelling in the area, and it probably won't even hurt the person if you poke these bruises. Not saying that you should, but most of the time the bruises aren't sensitive when it comes down to it, which is something that's interesting. Okay. When shouldn't you get cupping? There's a couple of different reasons to not get cupping. So a handful of different things that are going on. So again, it's risk-free. There's not a lot of issues that you have to worry about, but you need to be safe, right? So anybody who bleeds easily or they can't stop the bleeding, you need to be careful. Certain areas on a woman who is pregnant, again, especially after like 7 months, you need to be careful with. Women who are menstruating can be an issue. And again, some of these are going to be more of the traditional Chinese medicine version of it, versus a more of a westernized kind of approach. If anybody that has metastatic kind of cancer, that would end up being problematic because again, it's increasing blood flow and you would be dragging fluid to an area to, maybe break off a piece of that metastatic cancer. So when it comes down to it, there are, you can have, if a person has bone fractures, you wouldn't want to do that then. Again, if there is an artery or if you can feel a pulse over the area, if there's a deep vein thrombosis, a deep vein thrombosis or a blood clot would be something to avoid. Areas of, persistent like edema, that would be problematic. If a person had open sores or ulcers or certain skin disorders, again, you wouldn't want to do it over that. Other tumors, fibroids, cysts, if a person has a high fever, and again, like I said before, again, anybody who has a bleeding disorder or if they're on blood thinners, those are people that you don't want to do this because they're going to bruise really bad, right? So, but there's a whole bunch of different stuff. So there's different places that you can find people who are trained in cupping. In the Toledo area, obviously, like I'm the best person to go to. No, but obviously, like being in Toledo, that's something that people in the area, there's not a lot of chiropractors and physical therapists that are in the area that do cupping. It happens more often with massage therapists. And depending on where you are, there is a website that you can go to that's called massagecupping.com, and you can find a practitioner list that where you enter in your zip code and you can find a list of practitioners that are nearby. That hopefully means that they have some training. But one of the things that's interesting about cupping is that there's not like some universal like certification for cupping. Some courses offer, like there are some companies that offer cupping courses, but there's not a lot of stuff that's out there. It is something that I think is beneficial and I think that it can help people, but it's something that you need to be aware of that, not everybody, has the same training. Like I said, safety issues, like if a person is doing fire cupping, again, the fire cupping, that's usually heating the inside air in the cup. You shouldn't be doing it over and over again to the point where you heat up the glass so that you can get somebody a burn, right? Anytime that somebody was doing fire cupping, that is something that you have to worry about getting burned or burning a person, right? So that's something to just kind of like keep in the back of your head. So there's multiple different things that are there. So, again, making sure that the person has like adequate training is always a good thing. Okay. So that is basically it. So when it comes down to it, I appreciate you being here, taking the time to watch and kind of go from there. So, it means a lot to kind of share this stuff with you. If you have any questions, obviously feel free to leave them in the comments down below. You can submit them to me using my contact form on the website. Website's there, besttoledochiropractor.com. And if you are interested and you're in the area and you want to try this out, go ahead and give us a call and we can hopefully get you out of pain. Thank you very much. And I will talk to you all later. Bye-bye.